Hi, my name is Angeli. This is my video validation remediation for my sterile skills, um, my sterile field skills. So the first question that I have to answer is, what are the important principles of establishing and maintaining a sterile field? So that would be like performing your hand hygiene, and making sure so it's maintaining your hygiene and maintaining your sterile field. That just includes like performing hand hygiene before you put on your gloves and like while you're putting on your gloves, making sure that you don't touch the non-sterile part of it with the sterile part of your glove. Um, and if you do touch that part, you would have to grab a new pair of gloves. Um, and then this also includes like, so that's in part of maintaining sterility. And then the other part is also like going off of maintaining sterility, it also just includes like your drapes and everything. So like for example, I had a straight cath, so I had to place the drape under my client's buttocks area, and for that I did have uh non-sterile gloves and that I grabbed the drape with in the 1 inch border and just placed it under them. And that's a way to maintain sterility. Um, and it's also just maintaining stability of all of your tools and equipment that you're going to use. So like your gloves, the catheter itself, the iodine packets. If you accidentally touch anything that isn't a part of that sterile packet, you would want to like restart or use a different kit just to reduce the risk of um, any infection that may come from breaking sterile field. Um, and then the potential consequences for breaking sterile field is like kind of what I just said. Um, this is really a big thing. Infections, especially in the hospital setting, there's a lot of germs, especially going from room to room. Like you have different patients and they may be there for different reasons. Um, and you're doing a procedure that is very invasive and that can introducing microbes there, it disrupts the natural flora that can lead to an infection. So like the really common one is getting a UTI from a Foley catheter or a straight catheter, just as it's going into the urethra and there's just microbes that shouldn't be there. And it's just super easy to prevent that from happening just by by staying sterile and making sure that you're not breaking sterility. Excuse me. And sorry, I just lost my train of thought. But you just don't want to break sterile field, and as that can like cause an infection, and that's just not safe for the patient. It's also something that's like unnecessary and that could have been prevented, something that's very preventable. Um, so in the future, to prevent my sterile field errors, I um I caught myself on a couple times when I broke sterile field, like I dropped below my waist, um, and I accidentally, like when I was putting the drape down, it folded upon itself, so it broke sterility. And I caught myself on that, but I didn't catch myself on even while I watched the video back before I submitted my assignment. I accidentally touched the rim of the tray, and that is not sterile. Um, and I don't know how that skipped my mind, but it's now I just know that like I need to completely understand what is sterile and what is not sterile. And even by like slightly touching it, I'm breaking sterility. Um, just because I do not want to cause an infection for any of my patients. That just is super unnecessary and something that's super easily preventable. Um, and then the next question is, what would I do if I saw someone breaking sterile field in the future? I'm sure it happens a lot. I mean, it's very easy to break sterile field. Um, you do it without even thinking about it. You don't realize what is sterile and what isn't. But if I saw, like, for say, like one of my colleagues, doing a catheter on someone and I saw that they broke sterile field, I wouldn't blatantly, just like call them out in front of the patient. That's super rude and inconsiderate. I would more or less just, hey, do you need help? Let me go get you a new set of gloves or a new kit or whatever. Try to make it like so that they understand that they broke sterile field or broke sterility and just help them instead of berating them in front of the patient. And yeah. And then after that, I would just go like maybe like, hey, do you want me to go over like the policy or like kind of ask if they have any questions of like, oh, do you know why I did that? To not like to help them further on, like, understand why I did that. But at the same time, I don't wanna cause any embarrassment. But I would definitely call it out just 'cause, we wanna decrease the amount of infections that we have in the hospital, especially if they can be preventable by just following, like, the practices of sterility and sterile field. And so the next question is, what is an HAI, sorry, which is a healthcare acquired infection. Um, so this is literally just according from the Washington State Department of Health, it's an infection that happens while you were in the healthcare facility or shortly after, like if you had just left an appointment. So like examples are like pneumonia, it's like hospital acquired if like one of your patients has pneumonia and then you go into the other patient's room, you forget to wash your hands or like gel in, gel out, um, and then you could potentially spread it to the next patient. They got it in the hospital by just being there and you expose them to that. So that is a hospital acquired infection, as well as like catheterizations that if they were to get a UTI to sort of say, that'd be a hospital acquired infection because they got it while you did the procedure in the hospital. Um, and then, so yeah, they're just like infections that happen under your care in the healthcare setting, um, that could have been prevented just by following like precautions, isolations, and like sterile maintaining sterility, and then also like following aseptic technique, which is like washing your hands and just all of this to prevent the spread of germs. Um, And then my last question is who pays for HAA? And so I had to do a little bit of research, but prior to 2008, Medicare would pay for it all because it was an infection. So patients were getting sick and they'd pay for it for their treatment, as well as like insurance. But after 2008, there was like a bill passed and Medicare stopped paying for all of that. And since they stopped paying for like every year, um, they've saved $1.1 million. So that just like how much, um, goes to show how much like hospital acquired infections there are and how costly they can be. And it's just like, oh, that's a lot of infections that could have been prevented. Um, so yeah, that is all the questions I had to answer. Um, yeah, thank you.